Nursing Assistant Course Exam. Let's get started. A client who is confused begins to cry and scream out for the client's parent. What should the nurse aide do next? Is it A, place the client in a geriatric chair? Or B, restrain the client in his bed? Could it be C, talk to the client in a calm voice about familiar things? Or lastly D, leave the client alone in his room until he calms down? The correct answer is C. Here is why. This response uses therapeutic communication and validation to address the client's emotional distress and provide comfort. Placing in a geriatric chair is a form of restraint and is not a therapeutic response to emotional upset. Physical restraint is inappropriate, illegal for this situation, and will increase agitation. Leaving the client alone abandons them in a state of distress and is unsafe. Next question. Which of the following actions would be best for the nurse aide to take to show respect to the spiritual needs of a client? Is it A, escorting the client to religious services? Or B, discussing the nurse aide's religion with the client? Could it be C, assisting the client to read the client's religious materials? Or lastly D, requesting that the facility's spiritual advisor visits the client? The correct answer is C. Here is why. This action supports the client's own spiritual practices without imposing any personal beliefs of the aide. Escorting to services is helpful, but may not be possible or desired by all clients. Discussing the aide's own religion is inappropriate and shifts focus away from the client's needs. Requesting a visit from the facility's advisor may be helpful, but it assumes the client shares that faith. Assisting with their own materials is more universally respectful. Next question. While the nurse aide is providing care to the client calls the nurse aide by the name of the client's child, who died several years ago. The nurse aide's best response would be to: Is it A, quickly finish providing care and leave the client alone? Or B, pretend to be the client's child? Could it be C, ignore the client because the client is confused? Or lastly D, ask the client about the client's favorite memories of the client's child? The correct answer is D. Here is why. This response uses reminiscence therapy, which can be comforting and validating for a confused client, turning a moment of confusion into a positive interaction. Hurrying and leaving avoids the emotional need and may feel rejecting. Pretending to be the child is deceptive and can reinforce the confusion. Ignoring the client is dismissive and fails to provide therapeutic communication. Next question. When providing care for a client receiving oxygen therapy, the nurse aide should: Is it A, check ears for pressure points? Or B, tape cracks in oxygen tubing? Could it be C, let the nurse know that the nurse aide cannot care for the client? Or lastly D, change the flow rate if the client is short of breath? The correct answer is A. Here is why. Oxygen tubing or nasal cannula straps can cause skin breakdown on the ears and cheeks. Regular skin checks are essential. Taping cracks in tubing is unsafe. Damaged oxygen equipment should be replaced to ensure proper function and avoid fire risk. Stating an inability to care for the client is not appropriate. Caring for clients on oxygen is within the aide's scope with proper training. Changing the flow rate is outside the aide's scope of practice. Only licensed personnel can adjust oxygen settings. Next question. A client falls and suffers a deep cut on the forehead. What should the nurse aide do next? Is it A, take the client to the hospital? Or B, help the client back to the bed? Could it be C, take the client into the bathroom to wash out the cut? Or lastly D, stay with the client and call for help? The correct answer is D. Here is why. The aide's first duty is to ensure the client is not moved if a spinal injury is suspected and to immediately summon the licensed nurse for assessment and further instructions. Transporting the client independently could worsen potential injuries. Helping the client up before assessment could cause harm if there are fractures or spinal trauma. Attempting to clean a deep wound is not the first priority. Controlling bleeding with gloves and a clean cloth may be done while calling for help, but the cut needs professional evaluation. Next question. The client has been sad and depressed since being admitted to the facility yesterday. What would be the best thing for the nurse aide to do for the client? Is it A, arrange for the client's spiritual advisor to visit the client? Or B, turn on the television in the client's room and leave the client alone? Could it be C, force the client to take part in facility activities? Or lastly D, introduce the client to other clients and staff members? The correct answer is D. Here is why. Social integration and friendly introductions can help alleviate feelings of isolation and loneliness that contribute to depression. Arranging a spiritual visit may be beneficial later, but forcing social or spiritual interaction is not the first step. Leaving the client alone with the TV ignores the need for human connection and support. Forcing participation in activities can increase resistance and negative feelings. That's it for today. How many did you score? Let me know in the comments. Please like and subscribe, and tell me what topic I should cover next. Bye.